You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
We are committed to the pharmacy owner's success. PrimeRx believes in empowering pharmacies with innovative solutions to thrive in today's competitive landscape. We look forward to working with pharmacy owners and sharing how our solutions can contribute to their sustained profitability and growth. Connect with us on the web by going to PrimeRx.io. That's PrimeRx.io.
You put me in a room with a pharmacist, sprinkle in some technology, maybe even some pharmacy software, and let's talk data. And I'm an excited guy. My name's Todd Urey, founder of the Pharmacy Podcast Network. I started in pharmacy, soaking in data through pharmacy management systems and technology that really helped to position operations to understand what their patients needed, and then sometimes what the hospital systems needed, what the long-term care facilities needed. Now we jettison ahead 20 years later, and we're in the age of AI. We're in the age of big data being leveraged to save money and to keep pharmacies alive. I'm so thrilled to welcome Dr. Matthew Song, PharmD, and he's with the PrimeRx team. Matthew works with the technology group. He's the director of data engineering and analytics. What better person to talk about data? Matthew, welcome.
Nice to meet you, Todd. I'm honored to be on your podcast. Thank you.
Well, we're honored to have you. This is the Pharmacy Podcast Tech Trends by the PrimeRx team. For all of their shows, please go to primerx.io/podcasts. Once again, that's primerx.io/podcasts. Matthew, I want to jump right into this. As I opened up, data is, to me, in my junior level of understanding it compared to you, and you're seeing it almost like Neo saw the Matrix, where he saw the coding happening. He could make pictures out of code. I'm at a level where I can look at it like a map, but it is a map. Data is a map, and it can lead us to different things. And so just right off the bat, talk to us about your experience as a pharmacist and as someone who really values data and understands that, in fact, it does help guide us in our businesses.
Yeah, of course. Pharmacy data is definitely a map, and it's more than a map. You can use the data to your advantage. You can analyze it, dice it, and you could draw a lot of strategies from it. When I first graduated from pharmacy school, I started my career as inpatient pharmacist at a hospital, rural hospital. And every day I was working on, treating patients, dispensing medications. And I realized how much data you need in order to treat a patient, and how much the EHR data would help me efficiently treat patients. For example, finding patients with AKI, acute kidney injury, and just, how do I easily select a patient? At the time I was using a EHR that didn't have those tools available for you to easily find patients with AKI or patients with antibiotics, and just having those lists to me would have saved me a lot of time. And that's something I always thought about as a pharmacist working at my desk. How do I treat patients better? And that's when I really needed to have the tools that would analyze the data for you as a clinical pharmacist.
Matthew, that's the clinical side of data that continues to accumulate. I think of the lifetime of a human being, and I'm that Gen Xer, so the tracking of my life and data was much smaller than someone that was born, let's say 10, even 20 years ago, where the EHR has really started to be accumulative for us to be able to track Hey, what was your health like when you were first born? Did you go through anything clinically? Did you need anything special that was out of the ordinary? Maybe something that was a chronic condition. What was the reaction of our physicians? What was the reaction and medications that were used in treatment plans? And then what was the follow-up data? Now that individual was 25 years old, and we can look back on trends. We can look back on data to really help map maybe what that next test would be. Maybe it's pharmacogenomics, or maybe it's dialing into diabetes care or preventative care. I think data today, Matthew, is so much more useful and powerful because of the types of tools that we have at our disposal as clinicians. You're the clinician, you're the PharmD, and so that leads me to our next question, which is, how do you see our independent community pharmacists who are being challenged to transform their businesses from prescription-based business, meaning we're getting a dispensing fee, we're working everything around the single prescription. That's going to continue to sunset, and you're going to see the rise of pharmacists dialing into data to really become more clinical advisors for people in a multitude of different conditions. But how do you see that continuing to become a focus in empowering our pharmacists?
Yeah, of course. Pharmacy industry is easily one of the most regulated and controlled businesses in the nation, if not the most regulated and controlled business in the nation. So running a pharmacy isn't easy, and pharmacists are not trained to be business owners or business analysts from pharmacy school, but they would have to function as one in order to run the business, understand laws and regulations, and understand the finances and economics in order to be successful in the pharmacy business. And data is the best tool you can utilize to become successful in the pharmacy business. And I would like to share some strategies with the pharmacist listeners. So using your pharmacy's own data to diagnose, you can use that to diagnose your business, and you can use the data to your advantage. So that's something I would like to share.
Yes, and I think we can break that into categories, especially like what we were saying about we're moving away from just the revenue that's coming in from the prescription fee, and now we're going to be moving to being able to make money as a pharmacist based on your knowledge of maybe a specific disease state, conditions, titration, if it were like a medicine that you're moving from one to the next. But let's talk about the business side of the data, because the pharmacists listening right now, the pharmacy owners listening right now, they know better than anyone that it's data that's really going to help them see the bigger picture and start making some decisions. So first of all, let's talk about how could we tap into understanding where our top payers, who our top payers were, where that money was coming from, and being able to make some pivots to ensure that we can keep that going as much as possible.
Yeah, of course. So I would like to share how to utilize top payers data. So I would like to start with the saying, pharmacy data is your compass, PBM is the storm. So you can't stop the weather, but you can navigate it wisely with data. So I want to start with a small equation, economics equation. It's profit equals revenue minus cost. So PBM is definitely the revenue side of it for your pharmacy, because it gives you reimbursements for your prescriptions. And when you first open your pharmacy, you're signed into an agreement with usually a PSAO, Pharmacy Services Administrative Organization. And PSAO, their function is to negotiate with the PBMs and create kind of a group contract for your pharmacy. because pharmacies are usually difficult to write, sign contracts with, hundreds of PBMs and payers. Uh, it would be very difficult to write hundreds of contracts with them. So PSAO usually pre-contracts for you, and if you're a pharmacy owner starting a business, you can just sign in with the PSAO, and you should be good. You're contracted with hundreds of payers and PBMs. However, when I ran a pharmacy in the past, that the reimbursement rate wasn't good for my pharmacy. And so we had to go and renegotiate with some of the PBMs. And the first thing we did was to look at our top payers by volume for the top payers. And we selected top 5 payers or PBMs and then renegotiated with them. And so we carved them out of our PSAO contracts and then renegotiated with them to get better contracts. So one of the reasons we did that was because the reimbursement rate wasn't good, and also we thought we could negotiate better. So we used a couple things to renegotiate. First thing is that we were a rural pharmacy. So rural pharmacy, you could get better rates than regular PSAO rates. So that was one thing. And another, we were also serving skilled care nursing homes. So if you are LTC pharmacy, you can also renegotiate for LTC, prices. So those were 2 things we used that data for in order to renegotiate for better reimbursement rates. And just to put it out there as a caveat, not all PSAOs allow for pharmacies to carve out a negotiation. So just make sure with your PSAO and see if that is possible option for you.
So I'm noticing, Matthew, that there's some changes happening in the business of pharmacy where you have people like Dr. Kyle McCormick out of Pittsburgh that has done away with PBMs 100%. He's now a cash-based, he's a club-based pharmacy. He's doing away with that. There's the manufacturers who are starting to approach some larger pharmacy entities and starting to directly contract with them, avoiding PBMs, avoiding the PSAOs. So with that dynamic happening, I think that PSAOs will be more open to the savvy pharmacy business owner out there coming to them and saying, listen, I'm going to carve out my top 3 PBMs and I'm going to go to them directly in order to negotiate, because it's our lifeblood, it's survivability, it's trying to get the most out of it. So even though your PSAO might say, hey, we don't want you to do that, or you're not allowed to do that, I would challenge everybody listening, every single pharmacist listening, pharmacy owner listening, that you could press those PSAOs with some of those ideas if you have the data, and better than just the data is making sense of it. So talk to us about the tools in place to actually make sense of that. And then I also want you to talk with our listeners about some other strategies, including finding revenue and the best profit in specific drugs by volume.
Yeah, that's a good point, Todd. I wasn't aware that there's some trends. People were moving away from PBMs. That's a very interesting point, because this is a double-edged sword, right? So if you're moving away from PBMs altogether, cash only, you might be able to save some costs for your customers, but you may be losing a lot of your patients. Majority of the people are insured. So patients who want to use their insurance, may not be a good customer for you. But if their insurance wasn't paying well, either, then maybe, yeah, that's a good strategy to go with. So the second topic that I wanted to speak about was try to pull the top drugs by volume or revenue or profit, and if your pharmacy system allows, that is a very good report to go to. So I want to start by another saying: knowing your drug data is like knowing your vitals. It tells you if your business is stable or slipping, right? So you can't treat what you don't measure, right? So, think like a clinical pharmacist, and your pharmacy is your patient, right? So when you're treating a patient, you need to draw the labs, know the vitals, and see where it's broken, right? And so exactly the same way, looking at your drug data is just like knowing the vitals for your pharmacy business. You will see which drug is your top performing drug in terms of volume or in terms of revenue or profit. Your drug could be very, very high in volume. However, if your profit margin is really small, there is something you can do about it, right? So, first thing, because your profit equals revenue minus cost, you can either reduce the cost or improve the revenue, right? The easiest option is to go purchase the drug from the cheaper vendors. PrimeRx provides PrimeRx Market, where you can compare drug prices across 40 or 50 different vendors, secondary vendors, and purchase the cheapest drug from them. So that using PrimeRx Market, marketplace, that it can really help save drug costs for your business.
Mm-hmm.
And also you can optimize your inventory or reduce carrying costs. So for example, having too much inventory, you'll spend too much upfront costs, right? Or also, if you're carrying too little, you may be not being able to fill something. So setting like max and minimum of your inventory per NDC or per product, depends on how you manage your inventories, it will be really good. So PrimeRx, our software actually has a good inventories tools for you. It's automated, and if you're not utilizing a perpetual inventory for your pharmacy, it'll be really good idea to manage that. To start using it, to start using your perpetual inventory for your pharmacy, using your pharmacy system. PrimeRx has a very good inventory management system, just to let you know. And so, yeah, these are some of the options. And also there are various ways you can go about by using top drugs by volume or profit or revenue. You could also identify some clinical service opportunities like MTM or some adherence programs for your patients. So for example, if these are, top drugs selling, you could open an MTM service for that, specific drug. Or if it's a maintenance drug, then you can try an adherence programs to even further increase the drug prescription volumes, and even bring in extra clinical revenues like MTN.
Yep. Yeah, we were talking about our payers at the beginning, really to dial into that, understand your data. The second thing that we're mentioning is the top drugs by volume, and the revenue and profit that comes from that. That can help us in buying. With PrimeRx Market, you're able to do things on the fly, which is really cool. Like you can literally be doing this. You could be filling a prescription out, and you can do the drop down to pick the medication, and you could literally buy without ever having to go. I remember back in the day, you had to go to a whole nother section of the software system to do anything. This is all built in when it's happening. But let's talk about the third thing, which I think is really interesting. And it's a good point that you helped us map out when we were talking about our podcast today. And that is the relationship that we have as pharmacy owners with our prescribers and how important that is for numerous reasons, including finding new opportunities to dive into trends that are happening, whether that's vaccines or whether that's maybe a specific disease state or a physician that's a specialist, that now you're getting a prescription on something that's out of the ordinary. Maybe it's like a specialty med or something. So talk to us about the data and the world of our top prescribers by volume and what that means to us as pharmacy owners.
Yes. Yeah, this is a very, very interesting topic. So you can utilize your pharmacy system to draw a report of your top prescribers or top clinics by prescription volume, and this data can be used strategically and clinically also. So I want to start by saying prescriber data turns relationships into strategy. So using prescriber data, you can use it to anticipate the needs, not just react to prescriptions coming in, but you can actually do proactive strategies with the clinics. So, for example, you can align clinical programs with the prescriber focus. So what I'm saying is know your top prescribers and what their clinics are, and align your pharmacy's clinical programs with them, go together. So for example, if your top prescriber's clinic is doing joint diabetes education, you can launch joint diabetes education together, A1C tracking and things like that. If they are starting immunization drives, for example, then you can see where you can fit in and do it together with your local clinic or hospital. And same thing with COPD, asthma, action plan coordinations. And you can do a lot of different things with your clinic instead of waiting for prescriptions to come in. And building these relationships with prescribers can go a very long term and really help your pharmacy to grow with them. So sharing, insights, sharing, these partnerships can go long term. I know a pharmacist who did very similar things. This pharmacy was a compounding pharmacy, and they were very good at compounding sterilized compounds, non-sterile compoundings, and they had a nearby prescriber who really whose patient demographics were hormone replacement therapy patients, and the pharmacy specialized into compounding. They talked to the doctor, they talked to the prescriber, and actually provided them with the compounding products that they can create. So they can compound for the prescriber's patients. So they came up with the compounding products together that the pharmacy can compound for their patients. And rest is history. So they were able to get a lot of compounding prescriptions. And at the time, compoundings weren't really covered by PBMs. So a lot of these were actually paid for by their patients by cash. So, they were able to get rid of a lot of headaches, whether compounding is going to be covered or not, because it wasn't, most of them were not covered. So, but yeah, this is like one of the examples of like aligning your clinical programs or understanding what the prescriber likes to prescribe, understanding, their specialties, understanding their preferred drug classes, and and syncing it with their clinical programs together. So this is one of the examples that you can grow with your local clinics together.
Absolutely. And then informing your prescribers, informing your physician partners of things that you're doing to surround the patient, that 360 degree of care, where if this is a diabetic patient, now your pharmacy says, hey, we have diabetic shoes, we have socks, special socks, we have, wheelchairs, we have durable medical equipment, we have other things that can become ancillary to the primary therapy. And if you're allowing your physicians to know that you are doing that for your patient base, they can't send they can't send their patients directly to your pharmacy, but they can always make a suggestion where they're like, oh, you're kind of going through your diabetes right now, or you're going through something. And I know the ABC community pharmacy down the street really dials into that. And I think that's all about relationships. Like you said, Matthew, it's using data to find your prescribers, but that's not the end point. The end point is using that data to solidify and make those relationships even stronger.
Yes. I also forgot to mention, when I first started my pharmacy business back in, I don't have a pharmacy anymore, but back in 2016, your local hospitals or clinics may not have your pharmacy in their system.
Mm-hmm.
And it's very important to make sure that to let them know, let your local clinics or hospitals know that your pharmacy exists, and have them entered into their database or their system. This is very important, because without that, they will not be able to write scripts to you. And that's something I realized after a few months of running the pharmacy business. I realized that the hospital didn't have us in their database. And so I had to call and ask them can you create my pharmacy within your database? Give them your MPI, NCPDP, your address, phone number, fax number, so that they can, send e-scripts to your pharmacy. And you would think that that is automated. They will have all the pharmacy lists in their database. Sometimes they do. Sometimes they get automated updates. Not all of them. So make sure to when you open your pharmacy business, let all the clinics nearby you and introduce your pharmacy, and have them added to their database, because without that, you won't be able to receive prescriptions for a long time. Maybe they'll be added down the road, but not right away. So that's one of the things I wanted to mention.
That sounds so simple, but boy, is that important. It's just to making your physicians and your clinics and your hospital systems aware of your presence and your passion about your community. And I think that also goes a long way. Hey, we saved the next one, the fourth point of really strengthening your business through data. This is the best. We saved the best for last, and that is our top patients and assuring that our patients are adherent. And what that means for profitability is enormous. One side is, you're giving a little extra to your top patients, showing them their appreciation. They might be generational. They might have, been the second, third generation coming to your pharmacy. And then on the other side, it's that adherence. I mean, adherence is so good for the health of our patient to stay on their medication, stay on their treatment, and being able to trend what that treatment is doing for them, and then being able to map it and then pass that data even back to physicians of how it's trending. But it also means that your revenue is going to stay in place, because you're keeping your patients on their medications, you're keeping them happy, you're surrounding them with other things that are ancillary to the primary therapy. So talk to us about number 4, the top patients and our patient adherence, and how data impacts that.
Yes, of course, Todd. So knowing your patients is super important. So I want to start by saying, if you know your patients by name, you care. But if you know them by data, you improve their care. So it's very important to know your top patients by prescription volume or profit or revenue. And they are your most loyal customers. And so, my boss always says, pharmacy is not in prescription business. Pharmacy is in refill business, meaning your pharmacy is rewarded in your patient's loyalty, right? So know your top 100 customers by volume. These are your most loyal customers. Make sure to follow up with their medications and with their medication adherence. Build loyalty through their personalization of their medicine. Assign these patients to MedSync programs. PrimeRx has MedSync program. It allows you to fill their medications on time as scheduled. You can also recognize their loyalty, reward their loyalty through discount, within your store. Let them know if there's any like payer impacts. There are some, every year there's some changes to your payers, right? So if you know your customers, just let them know when they're coming in, or by phone call or by text. Just let them know that your insurance is going to be impacted and things like that. So these are your most loyal customers. And this is another similar point. So make sure your pharmacy is your patient's preferred pharmacy in the EHR systems, in your local clinics and hospitals. You can't call clinics to do that. You have to let your patients know to please select your pharmacy as the preferred pharmacy when sending prescriptions. So when they go see your doctor, go to see their doctors. When they prescribe their medications, then in the EHR, you will automatically select your pharmacy whenever the patient comes in. So that is very important. It seems easy, right? But having your patient selecting your pharmacy as the preferred pharmacy in their doctor's clinic EHR, it will just default all their medications to come to you and prescriptions to come to you. And so, these are some of the kind of tips and that I would like to share. As a former informaticist, this is something I have been working with, is the EHR. So I've worked with EHRs, and EHRs are very manually updated,
Yeah.
many of them. And so just having your pharmacy updated there, and these things happen sometimes manually with the older systems, and sometimes newer systems too. So just having them updated in their EHR, having your pharmacy entered in their EHRs, it's very important.
This has been great, Matthew, for really mapping out how to leverage data better, how to get more out of our data. I want to just give a shout out to our listeners. If you are a PrimeRx user, you probably already know a lot of this. You probably have coaching and team members inside the PrimeRx family that has helped you. However, if you're not a PrimeRx user, reach out to the team. That they're here to strengthen independent community pharmacy, and they're packed full of ways to use data better. And by doing that, you may find yourself gravitating towards the systems that are in place at PrimeRx. But regardless, I want to give a shout out to our technicians. Thank you so much for being the right hand of our pharmacists. The pharmacy technicians sometimes become specialists in leveraging data and leveraging buy and leveraging inventory management, also patient engagement. So a shout out to our techs. And our pharmacy owners, if there's anything that our publication can research for you or do for you, including our team at PrimeRx, please reach out to us. You can email me at, my last name is Yuri, that's EURY at pharmacypodcast.com. Once again, that's Yuri at pharmacypodcast.com. And then take a look. There's so much information over at the PrimeRx website. It's primerx.io. Dr. Matthew Song, thank you so much for being on this podcast today and talking more about tech trends.
Thank you so much, Todd. It was nice speaking with you today.